Fever was one of the first widely known symptoms of COVID-19, and it's why many restaurants and businesses do temperature checks as a way to help stop the spread of the disease. There are growing questions, though, surrounding whether or not those temperature checks are actually effective. News 4's Alexandria Adams spoke with an infectious disease specialist at Vanderbilt about whether or not it's actually helping.
The issue with COVID-19 is that people who have symptoms of the illness tend to be the most contagious.
A fever is often the first symptom and warning sign for COVID-19. Many businesses, like restaurants, are relying on temperature checks as a way to help mitigate the spread.
If we think about the total population of people with COVID-19, people with symptoms are a bit of the tip of the iceberg. And if we can identify them and get them tested if they don't know they already have COVID, or at least isolate them from others, we may really be able to slow the transmission of the disease.
According to the CDC, you're considered to have a fever when your body's temperature reaches 100.4 degrees.
For some stores and businesses, and even at our hospital, we've set that threshold at an even 100 degrees Fahrenheit, which is still not a normal body temperature, and it's easier for people to understand as well.
But those who are showing symptoms are not the only people we need to be concerned about. It's the silent spreaders that are hard to watch out for.
People need to realize that if they feel 100% normal, not only could they still be infected with the COVID-19 causing virus, but they could be transmitting it to other people too.
COVID screenings and temperature checks are effective, according to the doctor I spoke with, but we should not solely rely on it. That's why it's so important that we wear our masks, practice good hand hygiene, and of course, social distancing. Carol.